Hi guys, they say trouble comes in threes. That was surely true for me. In the last 2 weeks, I had 3 health issues. One I mentioned in my earlier video, that was my infected finger, and then the bronze slashing my face while on my walk. And then just 4 days ago, I got up in the morning with a stiff and painful left jaw. It was extremely painful to open my mouth, very uncomfortable. I couldn't eat, I couldn't brush my teeth. My low point was when my daughter made pizzas, and I'm a foodie, so it was so frustrating not being able to enjoy them, especially whilst watching everyone else scoffing them. This condition is called TMJ disorder, which means temporomandibular joint disorder. So there are 2 large temporal bones and muscles and 2 mandible bones and muscles which make up this joint. So together they make a joint called TMJ. There are obviously many other bones and muscles which make this mechanism work, but we are just focusing on TMJ. So you will be surprised to know that this is the most used joint in our body. The movement of the jaw is affected by stress and grinding of teeth, and it can become quite painful if we open the mouth to eat or chew, etc. My dentist has told me that I grind my teeth at night, so I wear a mouth guard while sleeping. That prevents my teeth being ground down, but it doesn't resolve the issue of the tension the grinding causes. So now I've experienced this painful jaw a couple of times. I thought I must take steps to look after my body so that my body can look after me. So I started some exercises to release the tension and thus improve the flexibility of this joint. Today I would like to share those exercises with you and tips to get some relief without going to my doctor. But first thing first, since the jaw had a lot of inflammation and pain, I first took an anti-inflammatory tablet to reduce the inflammation. Also, I used cold pack from freezer. So you just cover it and then with a cloth, and then you use it, you just press it against this joint. So this is what I did quite a few times a day. I've learned the hard way that sometimes exercise can irritate your symptoms. There are some times when I should exercise through the pain, and other times I should rest to reduce the pain. So you have to know the difference. So I started to really pay attention to my posture. First of all, the thing is, we just jut our neck out while we are using, we just take it out, and while we are using computer or mobile, and we just continuously do that, and that's how it really creates this stiffness which affects our joint here as well. So one exercise that I did is chin tuck. So what you do is you just breathe in and then push back your neck like that, and then forward a few times. So it's not, you're not doing this, you're just jutting it out and backward like that a few times, especially when you're on computer and or mobile. So you just do it few times a day. That relaxes your neck muscles as well. So stretches as well as relaxes here. And the next day, when the inflammation subsided a little, now I could do a few exercises that loosen up the large 2 muscles that are responsible for the lower jaw movement. But what I did was, first I just did some stretching exercises. This is also very important. Even if you don't have this problem, I think because of our sedentary lifestyle, we need to do these slowly and gradually. Breathe in, breathe out, and then you do these 2. And then what I did was I held my face around the ear. So breathe in, and with the padding under the thumb, you move your face right and left. So what you do is you just slowly, but putting a lot of pressure under the ear lobe, you just turn your head right and then left. Just do it even if you don't have this problem. You'll see there's so much tension we have in this joint, and because we are pressing hard with this area, this padded area, it really relaxes this part, and this you can do as many times as you can. So this is what I did. And then the second action was massage, and this is with your knuckles. What you do is you massage side of the cheek and side of the head. So what you do is give it a good massage to these two muscles. This over here, this is a muscle which is masseter, and there is a big muscle here which is temporalis here. So you just, again, even if you don't have this problem, TMJ, you'll see there's a lot of tension we carry in those areas, and especially when you have TMJ, then it relaxes and it really makes the whole area much more flexible. The stiffness goes away. Okay, now the third exercise is you just put both of your thumbs under your chin and try to open and close your mouth with resistance, as if your thumb is not allowing your mouth to open and close. So this is the third exercise. And now the fourth one is with mouth wide open. Try to say vowels. Just remember, my fair lady. A, E, I, O, U. Yeah, I mean, I'm making funny faces, but that's the way it is. A, E, I, O, U. And again, you know, this whole area becomes so relaxed and stiffness is reduced. Actually, there are quite a few exercises that could be done, but these are the ones that are pretty simple ones that have really given me relief within 2 days. So hopefully, if you had suffered a bout of TMJ disorder, then these exercises will help you in no time. Please seek your doctor's advice if these tips they don't help you. To watch more videos on health and well-being, please press the subscribe button. Thank you.